I talk about this all the time, and it's my main shtick of what I'm trying to do. Are you a service provider? Are you a solutions provider? A service provider is someone that does something exactly the same as everyone else out there, and you open yourself up to these questions. Now, to become a solutions provider, it's how you educate people from the start and through the finish. And it starts with your marketing, with your content, with your messaging. And then understanding that you need to qualify people to come in and see you. Like, don't take everybody. If you take everybody, that's the other thing. If you take everybody, you're for nobody. So what I require, and everyone that I work with, especially anyone I coach or train in our own clinic, we have criteria to come see us because we are pitched as a solutions provider. We are pitched as specialists. Even the massage therapists that work for me, I have every one of my therapists only focus on a certain body region. I have just a neck person. You have just a shoulder person, and that's all they do. So essentially we have criteria. So in order to come and see us, you've had to have a neck or shoulder problem. That's all we fix. We don't treat the whole body. I think anyone that's trying to treat the whole body is missing out, and they're in a bad place. And then they're going to sit there and say, well, what if a knee comes in? Well, fuck it. There's 10,000 other necks that are out there. You just got to go look for them. Number two is they've had to deal with that problem for at least 6 months. I don't want to see you when you first hurt yourself, because you're not going to respect and you're not going to appreciate the level of detail that I do. And number three is you've had to fail care with at least 2 other providers: chiropractor, massage therapist, physical therapist, ortho. You know what? There's plenty of people out there that fit those criteria. If that doesn't happen and it's not, and you don't fit that, you know what? Hey, we're specialists. This is what we do. I can recommend this person down the road. And if they don't help you, come back. Now you're that authority figure. You own it. Then what we do is we do a consultation before they even come in. So I think what happens is we always think that the patient knows better, and they don't. They're just they're pretending like they do. They don't. They just want to be fixed, and they don't really care how you fix it, but you have to slow it down. So like we start by that criteria first. Secondly is then we do a video consultation over Zoom and talk about their problem and what's going on. And then we decide if we want to have them come in for an evaluation. So everyone's so quick to get that person in. And that's when you run into those problems. They're like, oh yeah, I need you to go deeper here. And I'm like, no, motherfucker. Like you don't tell me what to do. Like, I'm like, you're an accountant. Like, where the fuck did you learn about anatomy? I'm like, you know what? I'm going to come to your job tomorrow and I'm going to watch one video on freaking YouTube, and all of a sudden I'm an expert. But they do that in this care because we open it up and we're like, oh, I don't want to piss this person off. It's like, fuck that. There's plenty of people out there that want to be fixed. You don't need a lot of people. You don't need to be for everybody. Be that person in your area. And I teach this all the time. And the biggest thing is what's going on upstairs for massage therapists. They're like, oh, well, I'm just a massage therapist. Fuck that. Stop that. That's the story you used to tell yourself. That's your old story. And what I teach, the very first thing, if you're going to come in and do coaching and training with me and run my system, is you start by this. You start with what's called your elevator pitch. And I say, you go, hi, I'm Katie. Oh, hi, Katie. What do you do for work? Oh, I'm a massage therapist. Oh, yeah, I got this spot in here. You know, you ever get those people? Here's what I teach. Hi. You know, you're getting bullshit. Most people don't really even care when they ask what you do. They're just trying to fill small talk. What do you do, Katie? Well, I'm a soft tissue specialist. What's that? You get another question. Oh, great question. What I'm an expert in is I fix chronic and unresolved neck and shoulder pain without the use of drugs, injections, and surgeries. And I'm an expert at finding and fixing scar tissue and reducing inflammation from chronic injuries. This allows for a significant increase in function and a significant long-lasting relief in pain. Oh, shit.
Give me your number. How do I get into your appointment?
Talk to you. And that's what needs to happen in your marketing, in your webpage, everything like that. Be like, I'm the fucking man, I'm the fucking woman, and you'd be stupid not to come here. And they're never even like wondering if you're a massage therapist. They're just like, oh, well, I need that. And then you educate them throughout that process. But you set the tone of, I'm a big fucking deal. And you are lucky that I'm here and that this exists, because there's a bunch of bullshit out there that isn't going to be able to help you. And you got to own that. And you can only own that if you specialize in a certain area. And I recommend going all in on neck pain and shoulder pain, because everybody has it and nobody's fixing it. The chiropractors can get lucky with low back, physical therapy can get lucky with low back, but nobody's actually fixing neck pain. And think about how people are on their phones nonstop. And if you're a specialist, you demand respect. You don't get that bullshit of like, oh, I need you to go deeper. You don't. And you handle it because they respect you. You're sharp as a tack, you're enthusiastic, and a true expert. And I don't get those things. And when I do, and it does happen, I stop in the middle of the treatment and I take them over to the whiteboard and I draw out exactly what's happening. I understand you used to, go get a deep tissue massage and they'd go in there deeper. But actually, to break down scar tissue, it also needs, I'll kill them with all these details. I'll be like, it needs proper depth and then tension and a vector of this, and blah, 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 blah. And then they're like, okay. You kill an emotional person with logic, and then they're like, okay, and they ain't going to ask again. And if they do, you fucked up something earlier in the process. You did not pitch yourself that way. They're like, you're just a massage therapist. No, I'm not. I'm a soft tissue specialist that fixes chronic and unresolved neck pain. You got that? Cool. You want to find out more about it? Cool. Come in. We do a consultation. Well, I want treatment today. That's just not how we work. I have a high success rate because my process works. Oh, that doesn't work for me. Good, then fuck off. There's another person that I need to get in. And you have to have that mentality. You got to be like, next. And it starts with your marketing and your message. And nobody does that. They're like, oh, I do Reiki, or I do this, or I do this. And it's like, no one gives a shit. It's like, I fix your problem. Want to find out more? Let's go. You have to be a master and you have to be a specialist. And what I'm finding is when you're solving a problem, getting them out of chronic pain and getting them functioning better, people are going to be willing to take more risks. I say risks with their health, and they're going to be willing to come in with the risk of getting COVID, and because you're actually fixing their problem. And think about this. Who are the first wave of people to get shut down? Massage, things like that are considered non-essential. You can sit there and tell yourself you're essential all day long, but it doesn't matter. The government told you were non-essential, and that's your own profession's fault. And that's your schools, and that's the education system, and you're not properly educating people. And that's what I'm on a mission to do, is get people access to this care. But it starts with changing the story you tell yourself. As a massage therapist, you're not a massage therapist. You are a specialist, and you have to own that. And you got to fake it a little bit till you make it, but own that and be that person that is solving problems, because people pay way more for a solution than they ever will for service. And if no one else is doing what you're doing, you can be fine if someone's like, oh, I'm not coming in anymore. You're an asshole. Great. Good riddance. I'm on to the next person. I believe in massage therapists that are willing to understand that what they were taught in school was bullshit and they didn't get the right things that they needed. And I believe in them, but they have to start believing in themselves. And nobody else out there is showing them how to do it. They're just going to these technique and these treatment things, and they're like, just do my system and keep coming back and coming back. And I'm tired of that. I'm tired of that. You guys have the best hands, the best skill set, but you have to find a way, and you need a path and a process. And that's what my process is, the peak method. And we're showing it, and we're teaching it, and it helps you get your swagger and your confidence so you can get the practice in the life that you deserve, but you also get the benefit of doing the highest level of good possible and truly changing somebody's life. And that's what gets me up in the morning and keeps me going, knowing that there are people like you out there that want to be better and want to do things differently. Because if you don't adapt and you don't change, you're done.